Hi, I'm Dr. Josh White. I'm the Chief Medical Officer here at Gifford Medical Center, and this is another clinical update talking about COVID. The conversation has changed quite a bit, and now we're talking about living with COVID. I intend this to be a hopeful conversation, much unlike a lot of the earlier talks we had about the pandemic. And it's important to understand that we live in a different time, and there's a different virus now than just a couple of years ago. So the situation has changed, and your thinking should change. Getting into that, we'll start with the trickier stuff first. The Omicron virus is quite a bit different than the initial COVID virus. And we first had these conversations, we talked about things like social distancing and masking and how to avoid the virus and how to not get sick. Unfortunately, in this day and age, that's not going to happen anymore. The Omicron virus now, by some estimates, is the most infectious agent known to science, more so than measles, such that unless you elect to buy a cabin and live in the woods in northern Alaska with no human interaction, you're going to get exposure to COVID and probably get COVID. And that's just the world we live in. And declaring otherwise would be similar to declaring that I'm never going to get a cold again. That being said, the environment has changed markedly, and there are a lot of reasons to be comfortable with that. Although I've had COVID a couple of times myself and don't particularly enjoy it, I'm not afraid of it anymore, and neither should you be. The most significant difference now, aside from the fact that we know what to do with this new disease, is that we have a vaccine, several vaccines actually, that are incredibly effective. If you look at the CDC's website, the mortality in COVID is about 1.1% overall, which is a little bit high. But when you start to get into that and you look at individuals that have had the vaccine and boosters, the mortality is about 0.1 per 100,000 every week. Really low. As opposed to that, unvaccinated individuals account for about 1.71, or about 17 times the risk of a boosted person. And so if you want to live in an environment where you're lower risk, you have that opportunity. Get the vaccines, get the boosters. It significantly lowers your risk. To put that into context, if we check the Vermont DOT data and we look at auto fatality in the year 2020, the deaths per 100,000 for Vermonters in 1 week was about 0.18, almost twice as high as your risk from COVID. So if you get in a car today, you should be about twice as concerned about that car ride as you should for COVID if you've been boosted. More so if you do get COVID and it's a worrisome situation, maybe you're older, maybe you have healthcare risks, there are things we can do about it. There are drugs that effectively are modern scientific miracles. Paxlovid being the most common example. A lot of you have probably had Paxlovid. Paxlovid is about 89% effective at reducing morbidity and mortality for people that are appropriate for that drug. That's one of the most efficacious drugs that has ever been identified. There has been no antiviral that's approached anywhere near that, including drugs like Tamiflu. So we have opportunities to do things to further reduce the risk. Beyond that, we have monoclonal antibodies, and the drug companies keep producing new monoclonal antibodies for the new versions of COVID, and there's a new one for Omicron. That is 98.6% efficacious at reducing progression of the disease. So if you get COVID and you need those monoclonal antibodies, you're high risk. By and large, we can stop that disease with really high efficacy. More effective than almost any drug we have in our armamentarium, the whole pharmacy. Lastly, we've got Evusheld. Maybe you're higher risk and you can't get the vaccine because you're immunosuppressed and it won't work, or you have some sort of allergy. Evusheld can supplant the vaccine, and it's a shot that requires redoing about every 6 months or so, but that gives people 83% protection against progression of COVID or developing symptomatic COVID. So the long story short, the concerning conversations that we all had, the fear that I contributed in putting into people's hearts, because I was worried too as a physician. I didn't know how much risk there was for my family, and I didn't know how I was going to take care of my patients. We don't live there anymore, and we can move past that. We can get out, and with the holiday season coming, I encourage you, go see your family. Have your family come see you. Do the things that you used to do for the holidays, particularly with the angst and stress in this post-COVID world that we all now live in. Those kind of things are really important. And if something happens and you unfortunately come down with COVID, call your doctor. There are things that we can do about it. Of course, if you've already got that cough and fever, then don't go see your family. Continue to be kind. Talking now about the viral situation in the community at large. Turns out over the last couple of years, social distancing and wearing masks is really, really effective at reducing spread of viruses. And we saw very few cases of illnesses such as influenza and RSV. In doing that, since almost nobody had influenza or RSV in the last couple of years, almost nobody has that relative immunity that we used to experience every year with some percentage of the community having these diseases. And so they're spreading like wildfire through the population. RSV is here already, and you may have heard stories about it filling up emergency departments. In general, kids are not sicker. This is not a more virulent version of RSV. It's just that nobody's got any immunity, and so we're seeing more of them. That could be a problem in terms of where to put patients, but we're dealing with it. That's true for all the other upper respiratory viruses, and it's also anticipated that it's going to be true for influenza. The Southern Hemisphere experienced a particularly nasty influenza season, and that typically is predictive of what we get here in the Northern Hemisphere. So I would strongly encourage you to get your flu shot. Do the best you can to protect yourself and your neighbors. At a minimum, it's not a fun disease to have, and you don't want it.